My name is Robin Vernon-Harcourt and I am the Director of the Global Business Collaboration. We are delighted to have so many of you joining us today from around the world for our Pledge With Us webinar series. So I am so delighted to be joined by two of the founding partners of the Global Business Collaboration, BP and Sodexo, who are joining us today for a panel discussion to share their experiences and insights on how businesses can effectively communicate and signpost to mental health tools and support to both improve, support and protect your employees' well-being. So let me come to our panelists, and what we'd love to do is for each of you to introduce yourselves and give a bit of an introduction into your business and your business's approach and what we do as an organisation. So Catherine Gilbert, let me come to you first, and then Anaha, I'll come to you afterwards. Thank you, Catherine.
Thank you, Robin, and good morning and good afternoon to all of you. So briefly about myself, I joined Sodexo 27 years ago in Group HR, and I started heading a Group Employee Benefits in 2014, with among my first missions deploying a solution to support our employees with mental health issues and improve their quality of life. About Sodexo, Sodexo is a French family-owned company created in 1966, which offers a wide range of services meeting our clients' needs, assisting consumers at different stages of their lives. It delivers on-site services, increasing efficiency and well-being on the workplace, caring for patients at hospitals, fostering learning environment at schools, ensuring safety and comfort at remote sites. So I can give you some examples: catering, cleaning, facility management. We are doing a lot of things. It also delivers benefits and reward services, a tech-enabled employee benefits and engagement platform, which creates notably digital employee benefit solutions. We had 422,000 employees in 53 countries at the end of August 2022, out of which 95% of them are for on-site services, meaning they are on our clients' sites. They are not on Sodexo sites. They work in various segments: corporate, schools and universities, hospital and seniors, leisure, sometimes energy and resources, meaning either on-site or offshore sites. So about our customers, we serve about 100 million consumers daily throughout the world, who are as diverse as our workforce is. And our mission remains to improve the quality of life of our employees and the people we serve, and contribute to the economic, social and environmental progress in the communities where we operate. So if I should summarize, I would say that Sodexo is a service company whose main asset is its employees, and we are convinced that people's well-being is a key factor in performance, and we make it our mission.
Anaha, let me come to you to introduce yourself as well.
Thank you, Robin, and thank you, Catherine. I'm Anaha Belvalkar. I'm working with Sodexo and Namaste from India. I'm from India, Sodexo India. I've joined 13 years back to Sodexo and handling complete insurance portfolio. Insurance is employee specific, business specific, complete, and the wellness portfolio. So in the wellness, we extensively drive our employees this employee wellness, which is on the mental health. So we have a Sodexo Supports Me, which is a EAP program, and which we drive it extensively, which works more on the mental well-being of the people.
From BP, let me come to you next to introduce yourself and share a little bit more about BP.
Hi Robin, good morning or good afternoon everybody. Thanks so much for inviting me to be part of the conversation today. I think taking part is really important to me because During my career, I've been really fortunate to work across multiple sectors, including civil service, retail, finance, aviation, construction, and most recently energy when I joined BP about 18 months ago. And what I've seen is that organisations that truly care for their employees, their well-being, their mental health, can unlock so much potential and capability, and it's so powerful. And as you said, we don't have all the answers, but it's through conversations such as this and learning opportunities that I think we can really make progress in this space together. So introducing BP to you, many of you will have heard about BP, and we're an energy company delivering services to customers around the world, increasingly in ways that we believe will help drive the transition to a lower carbon future. And we do this through employing 65,000 people around the world in 65 countries, which, as you can imagine, leads to a diverse number of employee populations. So we have 3 core beliefs that we call who we are, and these shape how we work and they guide our decision making. And one of those core beliefs is care for others. I just wanted to share a quote that our CEO Bernard Looney said recently, because I think this really demonstrates the importance of how we see mental health and well-being at BP, and how actually it starts at the boardroom for us. So I just wanted to share that. And the quote is, the amount of energy that we all spend dealing with all of the stuff in our heads that we're worried about, if we could help release that and have it be okay to not be okay, which of course it is, imagine the energy that we could release. I think that's so powerful. So Robin, back to you.
I'm keen to dive in and really get to sort of the crux of our subject matter today and share your experiences with our audience. So Catherine from Sodexo, can you share with us a little bit more about the support that Sodexo offers globally to its employees and how you go about communicating and signposting that, considering that context that you shared, working across different countries, different client sites across different sectors? And what have you found to be effective in building strong engagement with your people?
Well, before talking about tools, I think that it is very important to highlight that it's first the question of mindset and culture. At Sodexo, we have a top leadership team who is really supportive about mental health support, and with the sponsorship of its members, we have developed several measures to increase this mindset and culture of mental health support. To give you an example, we have developed a training program about collective and empathetic leadership to foster self-care and care for others. This program is being rolled out in the organization currently, but beyond this program, which focuses on leaders mainly, we also offer a wide range of e-learning programs to our managers, so a level below, because the role of the manager is very vital and crucial in our organization. So these programs enable to raise managers' awareness about mental health issues and well-being, importance of well-being, and to remove stigma. These programs provide the managers with tools and tips to help the employee in need. For example, it gives some EAP referral. We can refer to a social assistant that we have in some places. So really, it's a program to raise mental health awareness among our managers. But beyond this culture of mental health, we also develop programs for our employees at global level. We have launched this year a program called Vita by Sodexo, which sets a core benefits package for our employees, which includes several items, such as first the paid parental leave, which is designed to support the well-being of our employees who are welcoming a newly born or adopted child at their home, so that they can certainly build a bond with the child and better balance professional and family life. Second item in this program paid per family leave because taking care of older parents or a sick child is sometimes very challenging personal situation, which impacts the employee's physical and emotional well-being. So, to avoid creating presenteeism, lack of work focus, and higher risk of accidents, we decided to offer some days off to the employees so that they can take care of their loved ones. Third, this program includes a life benefit because we make it our responsibility, that social responsibility, that none of our employees' family is left with a few resources should our employee die on the workplace or not. And finally, we have enhanced our commitment for the Employee Assistance Program because we already offered such a program back in 2014, so far before the COVID-19 crisis. So it shows you how engaged we are in this mental health support. But we reinforced this commitment through our Vita by Sodexo program in order to embark the very few lagging countries which were not equipped yet. But this EAP that we called Sodexo Supports Me includes psychological support, life management, and managerial services. These programs are put in place globally, but of course we are diverse. We have a complex organization with people scattered all around the world. So one communication cannot fit all. So we rely on the local teams to adapt and deploy their own communication. And because we are convinced that they better know than ourselves at group level, the population and how to communicate, which communication channel is the best to reach our employees and raise our employees' awareness about the tools that we have put in place. But I'm sure Anaga can go through what she's done in India, and you see that the measures are very successful.
Anaga, really delighted to have you with us because you are leading on Sodexo's wellbeing strategy in India and translating some of what Catherine has shared with us, particularly around the employee assistance program within the Indian business and for your employees in India as well. So can you tell us a little bit more about how you've gone about implementing the employee assistance program in India and what sort of cultural nuances that you needed to take into consideration, thinking about different awareness levels, different stigma levels, and what have you found most effective in increasing usage of the employee assistance program and the support that you have?
Thank you, Robin, and thank you, Catherine. As Catherine has mentioned, that we are a people company and we are working at client spaces. So we have to take the people, we have to handle the people carefully, and we have to handle all their needs, whether it is emotional, whether it is physical, whether it is we have to see their well-being of financial, so that they can be stable, they can work into this weekly, and our retention also will increase. So everything we have to look after this. So very happy to tell you that this mental well-being is very this subject is very it's important, and we really put a lot of effort to see that our people are in a good mental health. So when we are driving our extensively this mental health program. So I'll tell you, we have once from the last year we have almost we have doubled the usage of this people are utilizing the services of this Sodexo Supports Me. So what we have done it basically that we use our portal. So people on the portal we put all our helpline numbers. So this portal is portal called Access, which is very accessible to all the people. So the people can know what is their number, what is the helpline number, which is mentioned over here in support that services what they are, because we have partner. I guess it is a global partner, I guess, with whom we work for this for driving this initiative. So they have their hub, they have their library. So everything, all the details we have put it on our Access portal, so that employee can anytime go there in case they want to see all the library. They can see whatever they can read on it. Okay, and they can which is can access easily. Then we put SMS blast. These are the common things which we do, this SMS blasting or sending emails and all to reach out that these are our number, headline number, so that people can easily get it access. Third one is what we do it is we arrange a seminar, training sessions. We do it, and in the training session, so when employee joins the company, we inform them, see these are the services we have. So in case of anything is required, you please these are the number given. You can access to that number. Also, we have a SOS button at our Access portal, so that employee can go, and even in case any emergency thing, employee can just click on that SOS button, so that his line manager and the HR manager can come back, and they will connect with the people, and then employee can tell them. So this is accessible, so that employee can get if employee is in an issue, employee has any problem, they can easily connect with. Another thing is what we have looked at is what we have done. We have put on the laptop screensaver, so that employee can look at that. It is easily available. Fourth one, we have done. We have a lot of accommodations are there where migrant people are staying. So this migrant people feel very low. They are feel lonely. There is a cultural difference. So what we have done, we have made a posters. So if you see right hand side, Sodexo supports me. These posters are there. So we put all the posters to all the offices, at accommodations, in the offices, in the washrooms, so that it is easily available, all the numbers and connect. Okay. Then what we have done, we have a ZHM program, that is a zero harm mindset, so that employee should get the support. Employee should know which is for the leadership team. So leadership team should know what is a mental awareness for, what is how employee feels, if how they have to recognize whether the employee is feeling, how the employee is going through the stress, whether the employee is going for the stress, he is having some problems. So to make them aware, to understand how the employee is going through the problem, and then take a proactive action on that. So we conduct seminars, and we conduct webinars, so that the people these leaders know, and they can cascade to all the download people, so that people, at least if your colleague, your team member is having any such problem, at least to help them. Fourth thing is just see, only mental problem is there, mental wellness what we see, but how it is also important that we have to have the physical and the financial. He should be physically and financially happy also. Otherwise, it will be a really, because if he has a financial problem, definitely he will go with the stress. So what we have done, we have introduced small benefits. So we have a micro loan, we have advance against salary, such type of benefits we have introduced, so that employees their small requirements of the money can be sorted out, and they can get easily financial support, which will help them somewhere dilute the stress on them. Third thing, that their health is also important, because they work in the client spaces, they work for 12 hours. So it becomes very important for them to take care of their health. So what we have done, we do the periodically health checkup program also for them also, and for their family also. So what we do, some concessional rate we tie up with all the medical what we call diagnosis centers and all, so that where they can go there and do their health checkup with the nominal fees, by paying nominal fees. So that way we make sure that we can help people, and you will trust me, this really helps a lot. My people are really using it. Using these services, people are approaching. So and it's helpful for the people. That's what we are doing.
Catherine from BP, of course, we've heard quite a bit from Sodexo about their approach, and I'm sure you're hearing some sort of similarities, but some differences within that as well. So I'd love to pass that over to you and understand a bit more about how BP are approaching this, what support and tools that you have. Of course, you mentioned you work globally, but then localize that to your regional context as well. So what have you found that has worked effectively to build that engagement across your employee base?
Well, we're really fortunate at BP to have a wide range of mental health and wellbeing support products. For example, we have Headspace, we have our global wellbeing platform, we have our EAP app, very similar to Sodexo. We have a really active peer support network as well in champions and ambassadors. But I think no matter how great your products are, they're only good if people know about them, trust them, and engage with them. And I think one of the challenges that we're all facing at the moment is competing for airtime and headspace of our employees. How do we get people to prioritize reaching out for help when they need it, or actually looking after themselves in the first place even better? People are bombarded with messages on a daily basis and are struggling with information overload. So some of the challenges that we've been considering are, how do you make your messages stand out? And I think one of the other things that is important to think about is actually, in addition to all of the messages, how do you know which messages to go after? So before I joined this call, I Googled World Health Days, and I was overwhelmed with the choice that we could go after or focus on. For example, obviously we have Mental Health Awareness Week, big whoop, but we have stroke awareness, skin cancer awareness, World No Tobacco Day, National Walking Day, Lupus Awareness Day, and the list goes on. I think there was even a zombie day. But the point is, if I was an organisation, which ones would I pick? And if I'm an employee, it's so easy to get overloaded with all of this information, and it just becomes white noise. So it's really hard to differentiate between signposting to support or proactive interventions. And I think probably another thing that's important before I go on to what we're doing that's helped frame our thinking is, with information so easily available at people's fingertips these days, it's so easy to use Google Doctor or to download information that may not be from a trusted or clinical source. So it should be validated. So we've tried to look at these factors and think about what could we do to address some of the challenges. And what we came up with was to create a global wellbeing education calendar, so to create a global conversation, so we're all talking about the same things at the same time. Now, it might sound simple, but there are a few important layers to this that I just wanted to share today. Firstly, we took time to understand what are the key health and lifestyle risks of our global population. So we used this information to create a themed calendar around this. In our first year, we created 6 themes, but we revised it for our second year to 5. Because this creates more space to design the actual engagement campaign, but also to really embed the messages. And when we did that, we worked with our central comms team as well to embed it into BP's overall engagement calendar so that it goes out as a heartbeat and a drumbeat of engagement. And we embedded that at the beginning of the year so that business units knew what to expect in advance, and our wellbeing champions knew as well, so that they could get behind the plan and plan in advance. So a single global conversation of the key messages, and that's a really important point. And it amplifies the volume of the key messages. The themes we chose, whilst they weren't necessarily solely dedicated to mental health, they all had a clear mental health element to them. So it's a way of keeping the conversation continuous. As an example of that, if we think cancer's a huge health risk to so many people, it touches so many lives. But there are the medical elements about, knowing what the signs and symptoms are, what to do, go and reach out for help if you were to be worried about something. But actually the mental health lens is, well, actually, you may be concerned that you found something that you're worried about. There's a mental health lens to the anxiety and the worry of that. Then there's the treatments going through the process, huge mental health impacts for people. Caring for a loved one, actually tragically a loss to cancer, for example. So whilst we created an umbrella theme, it was broad enough to really hang so many different conversations that became relatable to so many people. With 65,000 people, everybody's on a different wellbeing journey, and it's really important to make it relatable so that people can connect. For each theme, we created an educational guide for our employees and line managers with clinically validated content using our medical teams. And we then just focused on 3 key messages. But the messages were proactive, bite-sized, and they encourage action. So it's really important to think about that as well. It's not just giving them a wealth of information, but actually what do you want them to do with that information? What change would you like them to make? We also hosted webinars centrally for our teams to draw on as well. And we translated them into local languages because I think that's important to ensure that the content really connects at a personal and deeper level. And the guides are able to be adapted by local teams. So we created the content, but the signposting and support services vary globally. So we wanted our teams to really update them so that they are relevant to the audiences that they're serving. I think one other key important point was we designed this as a bit of a backbone or a spine to all of our tools. So every theme, we could then hook in all of our other support services. So cancer, for example, Headspace had a cancer track within it. So we then leveraged that and found the unique way to bring Headspace into the cancer conversation. So in terms of strong engagement, Robin, I think when we started this journey, I was super nervous about whether this would actually land and whether it would be valued by the business. But what I have seen is that there is a real desire for this approach. We've received really positive feedback from both line managers, employees on a global scale. And now actually what we're seeing is comms teams are coming to us and employees asking us where the next campaign is, can they have it in advance? So that pull from the business means it's really reassuring to me because that means that the messages are being valued and are making a difference.
Catherine, that's brilliant. Thank you so much. So much happening within BP, and I really liked what you were saying around building that trust, so that trusted sources that are coming from the business, because we know as the wellbeing space expands, there's a lot more support out there. Obviously, Google is there, so I think that's such an important role that businesses can play as being that trusted source of support. I'd love to just, I guess, as if there's anybody within our audience that's thinking, oh wow, like that's great information, but where do I start? You know, it might feel a little bit overwhelming. What sort of quick wins, or I guess maybe recommendations, would you suggest for businesses who are, you know, looking at how they can build on their wellbeing strategy and starting to put in place perhaps some of the things that you and Catherine and Anaka are sharing as well?
Sure. Well, I'm not sure in mental health whether there are quick wins, but I certainly think there are some areas that I would suggest that organisations could prioritise their efforts on. I think the most important one would be prioritisation of resources on empowering and upskilling leaders to support their teams, for me. I think at BP, one of our deeply held beliefs that I mentioned earlier is people care for one another. And so one of the initiatives that we're currently working on is to take our mental health and resilience education and really embed it into our leadership development programs, so that it isn't an extra, it's not something on the side, it's truly in the heart of our leadership program, and it becomes part of the DNA of our leaders. I think that's the shift that I have seen and feel that is so important. So it's a small shift with a powerful message, but I would absolutely start there. I think some other top tips would be to have a balanced approach. It's not just about being reactive. A lot of mental health conversations are providing support to somebody that may have fallen and needs that extra help. But actually, we as organisations can do so much upfront to be reactive, proactive self-care. So again, I think it's about a balance. I think consider choice and relatability. Everybody is at a different stage in their journey. Diversity and inclusivity is a key component of any wellbeing strategy. So think about how you encourage others to connect with the topics. We've used some fantastic case studies to bring our services to life, but also we've similar to Sodexo, we've used EAP and we've introduced a hub app which provides the choice. People don't just have to phone a counsellor, they can instantly live chat now. So choice and relatability are really important components. with bringing a subject to life and encouraging people to talk and share their story, you do get another risk that you need to remember that is also important, which is boundary setting. Creating a compassionate workplace comes with the challenges of boundary setting. So that's also really important to consider, making sure people don't lean in too far, don't overshare something that they may want to pull back from. And also, what's the ask? So if I was to share a story with you, how is that going to encourage somebody to take action and get them to some help themselves? So it's really important to make sure that you have those builds and safeguards in there. So they're my quick wins, 5 of them.
That's brilliant, Catherine. That forms such a nice sort of blueprint for us to start thinking about as an organisations we're developing our approaches. Some really key things to doing there. And I really love how both, whilst Sodexo and BP have slightly different approaches and different support, actually you can see those things embedded across both organisations, which is brilliant. And now I wanted to come back to you, because you've done a really phenomenal job in really building the support and communicating that to your employees in India. And it sounds like you've learned a lot through that process as well. So I'm keen to sort of hear, what are your reflections from that process, and what are your future plans and goals on building on the work that you've put in place within India? What would you like to see next for your colleagues?
Okay, thank you, Robin. I just want to mention here that recently in January we have got a certification for India Sodexo as a great place to work. Okay, it's a certification we have got it from the renowned agency, and we have all the surveys and all they have done, and they found that we are the best, we are the great place to work. So it itself shows. And the future program, what I have to tell, we are what we are introducing now, the buddy program. So now what is the buddy program means to that we are, as soon as people join, when the people join in the organization, they feel that they should know, someone should be tell them where what to do, what is to be what are the departments, everything. They have so many questions because they come with them with a new company, and they want that this new company should accept them, they understand the company. So that what we have done we have done as a joining thing only. We assign one buddy for every employee. It is automatic things have been done. So each employee will, as soon as join, we assign one buddy to him. So he will help and support the person, and he's a trained EAP person. So any issues are that he can tackle this one. The second thing is what we have done, because we have almost 9,000 migrant people. So these migrant people, because they should not be the lonely, because they are staying at the staff accommodation, so which is lonely, away from the family. So what we have done, we have considered them to support them, their day-to-day activities, to know them how to, if they have any cultural issues, if they have any language issues, if they have any understanding issues, they have any food issues, whatever issues they have, to sort out that there is someone HR Mitra will be there. So one HR Mitra will be there. So there is a gang leader. We have assigned some gang leaders for this, especially for these migrant people to take care of. So that because the most of the issues where we have seen and we have observed everything, and this is all tested and seen, that they are the people where they have unstable minds and they have the issue, and which creates an issue which to sort out of that and to help them out, we are doing that. So we are going to this is just thought process, and we are working on that to provide them this Sodexo Mitra, so that now we have almost appointed 28 Mitra, so that these gang leaders will help them out. Now third thing is, as you say, even if you whatever programs, whatever initiatives we take it, but we have to be continuously check and see, and whether it is working properly, whether employees are really getting a benefit or not, because having so many facility or having so many of work we do it, but if people are, it is not reaching to the people, whether it is reached to people, whether the people are using it, whether people are aware, because the people are going, people are coming, there are new people are joining, whether they are aware of that. So to understand that, what we have done automated in the basically in the accommodation and all, we have automated the audits are there. So this audit, we have to find out whether it is reaching to the people, whether the audits of the safety orders of the accommodation, we have whether health posters are properly are placed in the accommodations things, whether people are aware that we have such EAP things are there or not. So all these we have virtual audits are happening there. So fourth importantly, that we have also to help the people is the people, basically employers are worried about their children education. So what we have done, we have introduced a family education guide on our app, on our portal only. We put a family education guide where the employees should are always in a tension by what my children will do, what education there, to know them, what are the career opportunities available, what are the education about the education information, about the universities available, courses available. So all the information we provided for at one place, we have put it, and we inform to the employee, this is the thing for you and your family, you can choose it, or not to worry about your parents, you can choose this and you can take the so these are the things what we see how we can support to the employee, and to keep them mentally happy, and to keep them mentally stable, so that they can work better